to our next case, Dr. Ravi Kumar, who's practicing a senior consultant at Anusya Rao Eye Clinic at Vijayawada and also in Nuzvid in Andhra Pradesh. On to you, Dr. Ravi Kumar.
Thank you, madam. Thank you for giving me this opportunity. Is it seen?
Yeah. Yes.
Iris dialysis is a surgical challenge managed by modified sewing machine technique and retrofixated iris claw IOL. This is a 60 years old male patient who presented with no improvement of vision even 1 month after cataract surgery. His best corrected visual acuity is 6/12 and N9 in the right eye. This is the slit lamp photograph showing a large iris dialysis extending from 7 o'clock to 11 o'clock position with no PC support and normal fundus. The challenge in this patient is to deal with aphakia without PC support and a large iris dialysis simultaneously in a single sitting. Iris dialysis is managed by our own innovative modified sewing machine technique published in Delhi Journal of Ophthalmology and Indian Journal of Ophthalmology. Coming to the management of aphakic component, since this patient is managed in a secondary level rural eye care sector where there are no retina services and lack of expertise in glued SFIOL, we decided to do retrofixated iris claw IOL. Main steps of our surgical technique consist of retrograde threading of 10-0 proline suture into 26 gauge long needle, creation of scleral tunnel parallel to iris dialysis, pupil constriction by pilocarpine injection, creation of suture loops by passing the needle with the suture through peripheral iris and scleral tunnel from inside out. Cutting the loops and tying them so that the knots get buried into scleral tunnel. Finally, closure of conjunctiva using 10O nylon or Vicryl. The original technique is made easier by using a 30 gauge dental needle called Septoject. After creating the suture loops, the first end of the proline suture and tied to the last end so that only one knot is sufficient for entire surgery. This patient had iris dialysis and while undergoing cataract surgery and left aphakic. Iris dialysis was repaired using modified sewing machine technique followed by iris claw IOL implantation. Yeah, thank you, madam, for giving me this opportunity.
Yeah, thank you. I missed out some things. One question to Dr. Debashish or Dr. Suven is there? Dr. Suven, he's there?
Yes, ma'am.
Dr. Suven,
Yeah, I'm here. Yeah.
do you have anything to comment on the iridodialysis part? Like, if there's a large iris repair, would you think there could be bunching of iris which would happen?
No, this is, I think, quite a well documented technique. Dr. Suhas Aldipurkar has shown this quite a few times, and I can see Dr. Ravi is also presented somewhere. So, yeah, because these are ultimately each one is effectively an interrupted suture over there. So
Yeah.
there is a gap between the sutures, and it's anchored at different points. So unlikely that it will get bunched up.
Mm. Okay.
You
Madam,
can
the
have a-
point was that the tissue will get bunched up towards the angle, and you have a peaked pupil there, and the pupil will be peaked. And I nowadays do a pupilloplasty after doing this. It's a long-standing one. Sometimes the tissue shrinks, and when you take sometimes larger bites. But I would like to thank and congratulate Dr. Ravi for showing me this long back, and I've been doing this technique only for the last many years now. And that is this is the wonderful technique to use. And if the pupil is like that, I do a pupilloplasty also. And
This
one
is a
more
wonderful
addition is that
technique, no doubt.
using a trocar and cannula and put the cannula there to put the needle through. See, that prevents a lot of uncontrolled movements of the tip of the needle, which happens when you hold only at the outer part of the back end of the needle. If we pass it through a cannula, which is the trocar cannula, which we regularly use through the limbus, lot of it is supported by the cannula, and the tip swaying movements at the tip can be minimized while taking the bites on the iris.
Yes, I learned from this procedure using the trocar. But the iris being the kind of tissue we know, this kind of a precarious situation where the iris root has been fixed up, putting a iris retrofixated lens, if you have somebody has put it in with his own hands, with that tucking in with that just repaired iris root, is really challenging. Well, at least it's challenging to me. Iris retrofixation of in this kind of a situation. I've never done it yet. I've seen it for the first time. Maybe I'll give it a try. But it's very
Actually, the enclavation is done 90 degrees away. The dialysis was on the temporal side, and the enclavation was done at 12 o'clock and 6 o'clock, sir, where it was.
but it is going to put some stress on the iris root.
Yeah. And madam, talking about the bunching of the iris, if you see the modified sewing machine technique where we pass the loop with the one end of the suture into the loops, the amount of peaking will be reduced because the equitable distribution will be there through all the loops. So bunching at one point will be very much reduced. Just to want to add on that point.
See, even if there is bunching, and let's say there is a peripheral anti-assigning K formation also over there, let's assuming. I mean, it's about 3-4 o'clock hours. It really doesn't matter. The rest of it is open, so it doesn't really matter.
Yeah. Yes. Thank